Hi friends, Jai Hind, Hare Krishna. This is part 2 of SOAP where we discussed already the subjective things. Now we are discussing the objective. What is going to come under objective? We already saw that objective means it is all based on facts, unbiased, balanced, and those that are measurable, the data on record that are measurable. These are what are called as objective measurements. Okay. Now, this objective assessment can be, divided into various parts. First one being the vital signs. Second one, the physical examination. Somebody called this as review of systems. That is also right. Lab data, radiological examination, other diagnostics, other clinicians' reports. These six things have to be cross-checked before we close this objective part. Okay, now in vital signs, what is it that are measurable, that are verifiable, that are quantifiable? Objective is all about measurability, verifiability, and quantifiability, right? So now vital signs includes what? Includes temperature, pulse rate, blood pressure, respiratory rate, and SpO2, pulse oximeter, blood oxygen. Okay, in temperature, what kind of temperature was measured? Like which route? Oral, tympanic, axillary, rectal, or skin temperature. See, this is required because when the patient is a pediatric, is a neonate, is a geriatric, he is not able to, we could not measure the oral temperature, then what was used? That has to be documented. Pulse rate, pulse rhythm, the volume of pulse, and the symmetry of pulse also matters. Normally, we just write down the pulse rates and we just leave it. The rhythm, whether it is increasing, whether it is decreasing, whether it is fluctuating, and the volume, the depth, the way you can feel the pulse, that also matters, and the symmetry of the pulse. These things have to be recorded. Next is the respiratory rate, respiratory depth, and the respiratory pattern. People may be coming up with shortness of breath. They may not have a deep breath, so they are going to just have shortness of breath. So the rate, the depth, and the pattern of respiration also have to be measured. Now, SpO2, if it is less than 92%, we have to note down hypoxia. If it is less than 85%, there would be visual and cognitive disturbance, and we need to understand that when we inquire the patient for the subjective matters also. That is not time to talk, that is time to act, right? So SpO2, will get affected in when the body temperature is very cool, also when there is nail polish, also when the person has just peeped into the clinic after smoking. So all these things will also impact SpO2. We should be aware of that. Okay, now please understand that all these objective measurements, there are age-based differences also. I hope we know this, that in case of pregnant lactating women, in case of neonates, in case of pediatrics, in case of adult pediatrics, in case of adults, in case of people above 40 years of age, in case of geriatrics, postmenopausal, all these conditions, there are certain changes that are allowed. The normal values are not same for a neonate, for a pediatric, for an adult, and all those people. So please don't generalize everything. See who the patient is, what is the age, what is the condition, then mark down the normal values. Please don't make a mistake. Now we move on to the second thing, the physical examination or the review of the systems. There are one, two, three, four methods like inspection, palpation, auscultation, and percussion. Inspection is seeing, palpation is feeling, auscultation is listening, and percussion is tapping and understanding. Right? Inspection. See what are the changes in the body, in the skin, in the appearance of various parts of the body. Palpation. Feel the texture, feel the tenderness, and all those things like whether the abdomen is soft, whether the abdomen is hard, whether you could able to feel the liver and all those things, that will be coming under palpation. Auscultation is listening, lungs, heartbeat, intestine sounds, etc. for their frequency, their intensity, and the quality of the sounds. That is called auscultation. Now, next is percussion, using small instruments or using the fingers, hands of the clinician or the pharmacist, tapping on various places like the abdomen, like the chest. Body will behave like a percussion instrument where if gas or fluid gets filled in, the sounds are going to be different. And this outcomes, the review of the systems, the outcomes are normally mentioned with the system, based on the system. It is mentioned as GI, abdomen, soft, respiration, fluid accumulation may be there, like that. So it is classified based on the systems, and it is mentioned over there. The third thing, we come to the lab data. We know lab data means blood test, urine test, cerebrospinal fluids, sputum, and semen. All those things fall under the lab data. Blood test, there are two things. There is a common or a specific test. Like for if you suspect some microorganism, or if you suspect some disease like typhoid, hepatitis, etc., etc., tuberculosis, you will go for a different set of tests. And in case of patients who are admitted for surgeries, who have come for a general medical checkup, the entire data has been will be taken. So there are general tests, there are specific tests based on the condition of the patient. We have to identify and understand whether the tests have been taken in a proper manner or not. There are two ways of looking at it. There are many places where you go by elimination criteria. Like you take all the tests and say that this is not there, this is not there, this is not there, and so the disease could be this, because some diseases have got overlapping signs and symptoms. When we are talking of signs and symptoms, I have mentioned in the bottom, you could see over here, the symptom means something that which the subjective or the patient says, like stomach pain. And sign is what is the objective thing, where the clinician does a physical examination and understands, and he writes it as abdomen is soft, tender, right? So this is the difference between symptom and sign. We need to understand that what is a sign, what is a symptom. Normally it is misunderstood on the other hand, like sign is something which the patient says. No, symptom is subjective, sign is objective. Let us understand that. And now next we come on to the part of radiology. Radiology, we know X-ray, computer tomography, magnetic resonance imaging, MRI, ultrasound, and PET. These are the major four ways of radiological examinations. Next, other diagnostic processes based on the requirement of the patient, like angiography, biopsy, antibiotic sensitivity test. If anything has been taken, those things have to be noted down. And followed by the other clinicians' reports, which is normally forgotten or overseen. When in case of multiple organ or system that are involved, or already they are undergoing any treatment, and there are various observations, it is a chronic disease where they come to this for a this instance for a acute disease, or they have been treated for an acute disease in the past, and they have come here for a chronic disease, or they have had a surgery in the past, or all those things, right? So basically this other clinicians reports, whether multiple organ is involved or not, has to be checked based on the past medication history, where subjective things are going to give you the past medication history. Now you will be checking. See, there are multiple areas where this will be coinciding, like cardio, diabetic, neuro, psychiatry, neuro, immunology, gynecology, endocrinology, onco, respiratory, ortho, neuro, rheumatology, like that. These are all interlinked departments where you will have to understand that the other clinicians' reports will be very much valid and important to be cross-checked. Not only that, in case of the past medication history or a chronic history, or a surgery that has been undergone by the patient when he is coming over here, and those reports will give you a lot of data which the patient may not give in the subjective or even in the objective methods, objective assessments, right? So all measurable data should be put on record, right? Whatever is being told by the clinician to be taken to confirm the diagnosis, that has to be brought onto record inside the objective column. So please understand that anything that is documentable, anything that is verifiable, anything that is quantifiable, anything that is measurable, which falls under all this, have to be noted down in the objective area. And now, where are you going to use this? Correlating this with the subjective, what the patient says and what has come. So, is there any overlapping, like, that and this are the same? Sometimes it may not be the same. The patient may not interpret it properly, but we have got proof that this is what is going to happen over here. In case there is something, fishy, or you are not able to finalize, or you feel that the patient is right and the tests are not being done amply, then that comes under pharmacist intervention to discuss with the doctor on whether to go for more tests or no, we will stop with this. Aim is not to increase the number of tests and sit in a comfort zone. This is what is called as the clinical eye, is the expertise which comes over a period of experience.